This is TDT Live. I'm STACY in Providence. Now, the Ministry of Health is hosting a virtual press conference to give us an update on COVID-19 here in Trinidad and Tobago. And we're bringing you live coverage on TTT and Talk City 91.1 FM and Suite 100 and Next 91.1. Now, we are also streaming online on Facebook at TTT Live Online. We turn now to the Minister of Communications, Donna Cox.
Hello and welcome to another virtual media conference to apprise you of government's efforts to combat COVID-19. Joining me today are the Minister of Health, the Honorable Terence Dial Singh, the Minister of National Security, the Honorable Stuart Young, and Acting Head of the Obstetrics and Gynecology Department at Port of Spain General Hospital, Dr. Sally Ann Ishmael. But here's some housekeeping before we hear from the Minister of Health. We are asking that you identify yourself and media house before you pose your questions. Do remember, you will need to use the YouTube link sent to your email prior to the beginning of this media conference, which allows you to see us. We are also asking you to raise your hand using the feature built into Zoom. This way, I will know who to call on next. For those not using your phones to join this meeting, remember to put it on silent because it will affect the audio quality. So let us now hear from the Minister of Health.
Thank you and good morning. Thank you, Minister Cox, my colleague to my left, Minister Stuart Young, and also Dr. Sally Ann Ishmael, who is here. My duty this morning is to give the national community an update on where we are with COVID-19 in terms of our statistics. As of 10 a.m. this morning, the tests submitted to CARFA, 553. Our positive tests as of 10 a.m. this morning will be 85. It must be remembered of that 85, 49 came from one source, and that source was actually from the cruise ship that we brought home those 68 passengers from Guadeloupe. If we take out that 49, because that is an unusual occurrence, it means that we have 34 otherwise cases in Trinidad and Tobago. The number of deaths, unfortunately, to date are 3, and our deepest condolences go out to those 3 families. Number of persons discharged to date remains at 1. Since announcing yesterday that there are many unexplored areas of COVID, and I did promise to bring some specialists to speak to the national community, we have received literally hundreds of questions from members of the public about COVID and pregnancy. To answer those questions, because that is a virtually unexplored part of the COVID story, as I said yesterday and keep on saying, the government has done its part. The Prime Minister has done his urging. The last leg of this tool now, for us to stand on it, is going to be the public. And what we are asking the public to do is this very simple message: stay home. It's a very simple message. And I'm hoping the discussion today could revolve around this. This is where we are now. To beat this virus and to beat community spread, because as Dr. Parashram has said yesterday, we now have possibly some local spread, which is one step away from community spread. So that is my simple opening introduction. Tests submitted 553, positive 85, of which 49 were from one source, deaths 3, discharge 1. And I will now hand over back to Minister Cox, and who will introduce our next speaker to answer the hundreds of questions that deal with COVID and pregnancy.
Thank you, Minister. It's time to hear from the Acting Head of the Obstetrics and Gynecology Department at Port of Spain General Hospital, Dr. Sally Ann Ishmael, who will be focusing on pregnancy and COVID-19.
Good morning, everyone. Honorable Ministers. I'd just like to start by saying that the Directorate of Women's Health, which was implemented in 2017, has been geared primarily to working towards improving maternal and neonatal services, newborn services, And in this era of pandemic COVID-19, the priorities have not changed. They remain the safety and well-being of women and the newborn babies. First of all, to diminish the transmission of COVID-19 to pregnant women, and of course to help in the treatment of patients, pregnant patients with suspected COVID-19 or confirmed COVID-19. But central to all of this will remain the importance of basic hygiene, maintaining social distancing, especially for the pregnant women. It is important that we realize that maternity services are essential, they are critical, and there should be no disruption to these services at all. Women who do not attend antenatal clinic visits, who decide to eliminate this as part of their care, actually put themselves and their infants, their babies, at tremendous risk. So I would definitely encourage everyone out there to make sure that they stay in touch with their healthcare teams and to ensure that their antenatal surveillance continues. Again, because the numbers of pregnant women out there that have had COVID are extremely small, the data that we have is quite limited. It's dynamic. So as it changes, as the information becomes available, we make ourselves available to correct and improve upon our protocols so that we can benefit our people, our pregnant women here in Trinidad. It is important also to note that things are not going to function the same way. Things have to change as a result of the social distancing. So there will be new clinic times, there will be new visiting hours. Visiting itself in hospitals and institutions will be limited. We urge people who need to be admitted to make sure that they limit the number of visitors that they have as well. And where possible, they can avoid bringing their children. When you come to antenatal clinic, you must make sure that you come in and get out as quickly as possible to limit your exposure. And if you follow the instructions of the healthcare professionals, I'm sure that all will run smoothly. Of course, these times also will apply to our support services. Ultrasounds and blood testing will also need to become a little bit more flexible. So we ask the public to bear with us in this respect. With respect to the impact of COVID-19 on the actual pregnant woman, I want to reassure everyone out there as well that the pregnant woman must not think that she's not capable of getting it. She is very much capable of getting it, just like anyone else. She is no different from the general population in terms of contracting it. It is also important for her to realize that if she's normal, if she's a healthy woman, if she is having a normal pregnancy, then if she has contracted it, she is more likely to have absolutely no symptoms or mild symptoms, and she's more likely to actually have a complete recovery. It is still, however, important because the data is limited, because things are evolving as time goes by, that she maintains social distancing and that she maintains personal hygiene during all of her pregnancy. It is also important to note that there is very limited information with respect to the impact on the baby, meaning that the information that we have so far is positive. We know that there is very little impact or very little possibility of cause or no harm, I have to correct myself. There is no evidence thus far that it has any impact on the development of the baby. And there is very little supporting evidence to suggest that it's transmitted to the baby during pregnancy or during labor. Breastfeeding is terribly important during this time as well. It's, of course, one way to maintain immunity because the antibodies are passed on through the breast milk to the baby. And there's very little evidence or no evidence thus far to suggest that the virus is actually passed on in that way. It's also important that, of course, the baby is going, the breast milk is a bonding issue. And of course, it's inexpensive and will avoid you actually having to go out and disrupt your social distancing. Okay, if there's any other questions, I could always attend later.
Okay, we'll be open for questions a little later. Let's hear from the Minister of National Security, the Honorable Stuart Young, who will speak on the importance of staying at home and some of the regulations put in place by the government to ensure your safety.
Thank you very much, Minister Cox, and allow me to start by congratulating Minister Cox and her team and the crew at TTT for allowing us to do these press conferences in virtual safety. And that starts the messaging from my point of view this morning. I listened to my colleague attentively yesterday, the Minister of Health, and listened, of course, to the Prime Minister on Sunday night. And I'd just like to add to what the Minister of Health, supported by the CMO, Dr. Parasaram, said yesterday. They said, stay at home, stay safe. I want to add one addition to that, Minister Diyal Singh. Save lives. The only way that we're going to be able to stay ahead of the curve, members of the media, wider listening and viewing public of Trinidad and Tobago, is following the advice of our medical experts at this time. The clear advice is that we should stay at home, therefore stay safe and save lives, thereby stopping the spread of this COVID-19. Over the past few days, there seems to have been some level of lack of clarity in the messaging, and I just want to use the opportunity this morning to let the general public know that there is no lack of clarity. In fact, in my conversations with the Commissioner of Police, both of us give the assurance that we are on the same page. The fight against COVID-19 is not a fight with respect to the law, and the messaging was never that persons should be arrested. The government's position and strong advisory position, which is similar language to what you hear being used in other jurisdictions as well, is please stay at home unless you absolutely have to go out. This is not about the police arresting anyone, although they will do what they have to within the parameters and confines of the law. We are asking people to please heed the advice of our medical experts. In helping this message, what I can announce here this morning is a decision has been taken based on the clear medical advice, and we will be amending our regulations today, the Minister of Health's regulations under the Public Health Ordinance, to reduce the number of persons who gather in any public place from 10 to 5. So the regulation will now read, during the period specified, which is until April 20th, persons shall not, without reasonable justification, gather in any public place where the number of persons gathered at any time exceeds 5. We are reducing it from the number of 10 to the number of 5. I just want to emphasize that this number is not a group that is together. So in public places that are not deemed to be essential, for example, supermarkets, banks, pharmacies, in public places, persons are not allowed in more than 5. And it doesn't mean that you have to be part of the group of 5. We are doing this in order to protect the population of Trinidad and Tobago. All of the measures are to protect. And as the Prime Minister very clearly said and articulately on Sunday, this is all about protection of people, and it is the use of common sense. So the Minister of Health, his CMO yesterday spoke about the exercising. There's no need to go back there. The Commissioner and Police and myself are in constant communication. On Sunday, I met with the heads of security, the Trinidad and Tobago Police Service, or Defense Force, or Intelligence Services at the National Operations Fusion Center, and we have contingency plans in place. We are continuing to do what we have always been doing, planning. We're asking for the population to please be part of the positive process, be part of the whole movement to beat COVID-19 and to ensure that it doesn't spread more than it should. We are doing everything that we can to ensure that the population is kept safe. The Minister of Works and Transport has also asked me to announce, carrying out what we asked last week, or what we announced last week, that there only be essential travel between Trinidad and Tobago via air bridge and or sea bridge. A decision was taken after consultation with the Tobago House of Assembly that we're taking the TNT Spirit off the inter-island sea bridge route. The Galleons Passage and the Jean de Valette will continue, but they will only make one trip back and forth per day. We are reducing the number of trips of the ferry, but the Cargo Star, the cargo ship, will continue with its normal ferry, its normal cargo service to ensure that cargo is transported to Tobago as often as it already is. This was done after consultation with the THA, and I was told as well the Tobago Chamber of Commerce. Ladies and gentlemen, now is not the time for mischief. Now is not the time for social irresponsibility. Now is the time for us all to be personally, socially responsible. One of the things that continues to disturb us is seeing persons gathered outside some of the essential services, the banks, the supermarkets, not so much the pharmacies. And even though inside social distancing is taking place, outside people are still cluttered. We are asking persons, this is for your own safety and protection, please have that social distancing outside. Please only leave your homes if absolutely necessary. The police will continue to be conducting roadblocks. Another point I'd like to emphasize is even before COVID-19, the police service has certain powers. The police service can ask anyone what is the business that they're about, especially at a heightened time like this. The police service, if they saw large gatherings of crowds and they determined that there was some risk associated with it, the police service can always ask us citizens to disperse and to move along. That is the existing law. What we're doing now, because of the heightened public health risk, is we're asking people to please stay at home and only leave if you're essential. It provided me with some degree of concern over the last few days as we were contacted by hundreds of people asking if they fall into the essential category. Even in the government service, we have limited the workers to those who are necessary. Every person who ventures out presents a risk or is exposed to a risk of spread of this disease, as we've heard the medical experts tell us over and over. So stay at home, stay safe, save lives. Yesterday, there was some disturbing video footage that is being investigated. We saw the Trinidad and Tobago Police Service. It appeared officers as well as Trinidad and Tobago Defense officers, force officers or personnel engaging in some behavior that is condemned and not condoned. The Chief of Defense Staff immediately, as well as the Commissioner of Police, immediately commenced investigations. Those persons, when found, will be dealt with in accordance with the law. The Trinidad and Tobago Police Service and Trinidad and Tobago Defense Force will continue to act in responsible manners. Unfortunately, throughout the world, you're always going to have a few rogue elements. At this time, it is not the time for that type of behavior. Another point I'd like to clarify, because there is a lot of mischief out there, including mischief, unfortunately, by those in the political arena. At no point in time did the government, through me, ever say that the Trinidad and Tobago Defense Force have any more powers than they have. The Trinidad and Tobago Defense Force at this time is in full support of the Trinidad and Tobago Police Service, and they are doing their part. And I'd like to take the opportunity to thank them for the support that they're giving, especially to the Ministry of Health and their personnel doing a fabulous job. Our Trinidad and Tobago Police Service officers who every day are putting themselves at risk, and now with this public health, they continue to protect and serve us. Our healthcare workers and all other frontline workers, our immigration workers who did it, our customs officers, even our media and communications personnel. I thank you all. The message is continue with your social distancing. Please stay at home. Only go out if necessary. The police are going to be conducting exercises where they are entitled to ask any one of us citizens where it is we're going to. And this is not about arresting people. That is the last thing that we want to do. But the police have shown that they will do it. So last night, again, unfortunately, There was a bar owner who was warned during the day yesterday to keep his bar closed. He assured the police he would. The police went away, and subsequently, a few hours later, were told he was doing the same activity again, opening his bar, people congregating, and serving alcohol as though the bar were open. He was arrested and is charged. So that is the second one. The police will do all that they have to do to keep the citizens of Trinidad and Tobago safe. I emphasize in closing that we really are asking only essential people be out on the roads and moving from their house. The government itself is leading from in front, and we have taken certain decisions with our various ministries to only have absolutely the essential staff out. So I'd like to just end by reminding, and the regulation will be published during the course of today, that we have taken a decision at the government level to reduce the number of persons who may be gathered at any time in any public space to 5, so only 5 persons. And this, of course, excludes the banks and other essential services or supermarkets or pharmacies. But we're asking persons who are there to please continue to protect your life, protect the lives of others, and to practice safe social distancing. Thank you very much, Minister Cox.
Thank you very much, Minister Young. At this time, members of the media, the floor is now open to questions from you. But before we take the first one, please remember to identify yourself and the media house you represent before posing your question. And for those not using your phones to join this meeting, put it on silent because it will affect the audio. So we are open for questions now. 98.1 FM, Stephen Cummings.
Yes, good morning. Can you hear me? Hello?
Yes, we are hearing you.
Yes, good morning. Just a question to the Minister of National Security. We've just, heard that there would be a further amendment or, to the regulations from 10 to 5 persons. I'm concerned about the persons going to the supermarkets. Of course, some supermarkets would have implemented their own, restrictions. But how are we really going to be able to manage that? It would be a very difficult task, especially even, going to the markets.
Okay.
I
understand the question, Mr. Cummings. Thank you very much. And thank you for the opportunity to clarify that. As I just said, the reduction of gatherings in public places from 10 to 5 obviously doesn't include outside the supermarkets and the banks, etc. But what we're asking persons to do, and this was a conversation I had with the Commissioner of Police and other members of the police service, they will do what they have been doing, which is encouraging people to exercise social distancing. But as we've heard the medical experts, as we heard the Prime Minister advise us, plead with us, strong advisory, it is up to each and every one of us to be socially responsible. Also, people, please try as much as possible to stay at home. There's no need to be going out to the bank and the supermarket every day. We understand that over the next few days, because it is the end of the month, there will be persons who are collecting their salaries, there will be persons who are collecting their pension checks, etc. The banks have been spoken to, they are cooperating, they will make the arrangements, different hours for our pensioners and our elderly who are more vulnerable during this time. But really it does come down to asking everyone to be personally socially responsible. And the police will do what they have to do. Because if police give instructions and they ask us to move along, etc., not outside these establishments, but otherwise, they know the powers that they have under the law.
Thank you. Akash Samaru, CNC3.
Hi, good morning. You all can hear me, right?
Yep.
Yes.
Okay, great. All right, Minister, I'm so sorry Dr. Parasram isn't there, but Minister of Health, now according to your information, 553 cases tested by CAFA so far. I'm interested in knowing how many samples are being rejected. What is the main reason for rejection? And what's the time frame to get my results? Because we have some people saying they're waiting up till 8 days despite being told they'll be contacted within 24 to 48 hours.
So, Akash, I know exactly where you're coming from because everybody saw the program this morning and the newspaper report yesterday. As we said from day one, The protocols for testing initially were if you have a travel history to a country with COVID, your primary contacts, like your family. We also said clearly members of the public with no travel history, with no primary contacts, will not be a priority for testing. I know the case you are speaking about, and that person never fit the criteria for priority testing over somebody who is symptomatic, with a positive travel history, and with primary or secondary contacts.
Minister,
Let me finish.
You're not talking about the same thing.
And these are the policies instituted by CARFA in conjunction with PAHO. The Ministry of Health does not guide the testing policies of CARFA. CARFA is a regional body that follows international best practice. And as I said in one of the earlier press conferences, individuals do not contact CARFA for their test results. The test results come to the ministry so we could track it. Because think about the danger if individuals received their results without it coming to the ministry. We will not know who is positive. We will not be able to put them in quarantine. We will not be able to test them. So all these policies instituted by CARFA, based on best practice, are what we are using in Trinidad and Tobago.
Yeah, Minister, I'm glad you made reference to an earlier case, but I'm not talking about that person at all. I'm talking about something completely different. So bear with me, right?
Sure.
We have a case of a 19-year-old citizen returning from the UK where she studies, and she came back with flu-like symptoms. The next day, she heard her close friend from Singapore, who she was in close contact with, tested positive on returning home to Singapore. Now, this was on March 16th, before you set up the COVID-19 hotline. So she started calling around and eventually got into contact with the Shagaramas Health Facility, which was referred to her by the Health Ministry. There she was told that the people who do the testing had gone home for the day. The next day she had to call back and was asked if she could come in to get tested, which she refused in case she had it. Then 3 days later, a doctor came and collected the sample. She was told she'd get results about 2 days later. 4 days later, she called and was told her sample could not have been found. 8 days later, she was told it was rejected on one criteria. So even though she had a travel history, she came in from the UK, she had contacts, so one of her best friends is now COVID-19 positive, who she was in contact with. She was rejected because she was told her sample wasn't tested within the 5 days of developing symptoms. Now, her concern, and I'm sure many other people listening right now, is how many people may be positive but are not being tested. So she had 2 of the 3 things and was still rejected, including in being in contact with somebody who had it.
So, Akash, the only way I could answer that is I will have no direct information about individuals. If that information was brought to our attention, we could have addressed it. But I can't verify what you are saying is in fact what transpired. But we do have protocols which we are using, and we continue to use it in the best interest of Trinidad and Tobago, but I don't have the particulars of that particular case. If you send it to me offline, we will surely investigate it and come to a solution.
Minister Dial Singh, if I may just throw in a thought here, in none of that discourse was it suggested, or was it being suggested that she had presented any symptoms herself, because that is part of the whole procedure as to whether you qualify for a test. So it's not only that you've traveled, it's not only that you've been in contact with someone who has now tested positive. The testing protocols by WHO that I've been listening to Minister Dial Singh and Parasaram tell us over continuously, you have to present symptoms. So if it is that this individual has now presented symptoms, then obviously get in contact with the Ministry of Health personnel and she will be retested. But nowhere in that discourse did I hear it suggested that she had presented the symptoms.
And let me just, because we have said this very, very often, testing an asymptomatic person will not yield the correct result. What you would get if you test an asymptomatic person is what we call a negative, but it will be a false negative. Because to get a true positive test, the person needs to have a certain viral load in their body, which appears when you start to develop symptoms. So we have to look at all the criteria. Were you symptomatic? Travel history, contact. You have to fulfill all three criteria. Because if we test you when you are asymptomatic, you will get a false negative test, which is dangerous. Because then you may think I am negative, and then you continue interacting with persons and spread the virus more. So Akash, I want to assure you that the protocols are there for the protection of not only the individual, but wider society. We cannot test asymptomatic persons. You will not get the viral load yield to give you a true positive test, and you will get a false negative test.
Okay, Nika Pasanlal, Loop TV News, Loop TTT News.
Hi, good morning to everyone sitting.
Morning.
Minister Young, this one is for you.
Thank you.
I think a few of us have gotten some reports of, I guess, for lack of a better description, a runaway case. Someone
Okay,
who was
yes.
possibly or not tested.
All right.
Where is this?
Yes.
Should we be?
Thank you very much, Ms. Pasanlal. That matter was brought to my attention by Trinidad and Tobago Police Service early this morning. I immediately contacted my colleague, the Minister of Health, as well as the Chief Medical Officer. To alleviate the concerns of the public, it appears as though it was a person who was in quarantine at one of the health facilities. He has not tested positive. And the person decided that they no longer wanted to be there and left. Right now, the police service are looking for him, but he has not tested positive. In fact, it was subsequently explained to me by the police service that the officer who put out the messaging was a little exuberant and a little too hasty in his messaging, but it shows how important it is we get things right. So there's no need for any panic or any level of concern. The police are looking for the individual. He has not tested positive. But of course, we get back to the same social responsibility. You don't want someone who we've put in quarantine running around outside there. So we also need the help of the members of the public. His family members and others will know who he is. Please contact us at either 999 or the 555 number that has been specifically set up by the Trinidad and Tobago Police Service.
Anna Ramdas, Trinidad Express.
She's muted.
Can't hear.
Anna, we are not hearing you.
She has to unmute.
I think it's us.
Right.
Yeah.
Yeah.
Hi, morning.
Morning.
Good morning.
Good morning. Ministers, if the cases of COVID are likely to rise, as we have been told, is it likely that the 2-week shutdown will be extended?
All right. Well, Ms. Ramdas, as you would have noted, the government has always said this matter is very, very fluid. We are making the decisions based on the medical advice that we get as soon as we believe necessary. For example, this morning we came here and we announced that we've reduced the number of persons in public places gathering from 10 to 5. So we will continue to monitor the situation, but all of our decisions at this stage are with a majority input and the pillar of medical health expert advice. So it remains fluid. Right now, we are looking at April 15th, but nothing is written in stone at this stage.
Minister Young, are you in touch with the persons, Trinidad and Tobago nationals, who are outside in Barbados, Suriname, Venezuela?
I am not personally in touch with them. As you know, and as the media have reported, for example, one person from Suriname appears to have retained attorneys who wrote to me. I responded to the attorneys telling them I will consider an application for an exemption. They got that to me on Saturday. I have passed it on to the lawyers as well as the Ministry of Health medical experts, and I've also asked them for certain information. We will continue to deal with these cases on a case-by-case basis. And again, our embassy in Caracas has been in touch with persons down there, and we continue to just monitor these things.
Alicia Boucher, TV6.
Ms. Boucher, we're not hearing you.
We're not hearing you.
Need to unmute the mic.
Okay,
Hello?
thank you.
Right.
Hi, good morning.
Morning.
First of all, I wanted to find out if the new regulations, the amendments to the regulations takes effect immediately. And secondly,
Okay, let me answer that. They will take effect as soon as Minister Dial Singh signs it.
okay, Minister, when would you be signing
Well,
it?
today.
Very soon.
And secondly, I also wanted to find out, this one came in from the public. They wanted to know what are some of the signs that they can look for. I mean, we know that the aim is to flatten the curve, but is there a time period after that curve is flattened that they can look for signs of things returning to some form of normalcy?
Okay, so let's pretend we are fighting a war. In any war, there must be an exit strategy. But it is too soon to talk about that, and I'll tell you why. If we start to talk about that, the population may be lulled into a sense, this thing is coming to an end. Let us start to congregate. Let us start to do this. Let us start to go back to normal. We want to keep the pressure on. We want to keep a lid on this thing. And again, the only thing that we want to focus on, the only message that we need to push is this message: stay home. It is too early to talk about an exit strategy at this point in time. The only thing that will flatten the curve is to stay home. Isolate yourself, quarantine yourself. Be responsible. I used the analogy yesterday. What we are trying to do is to put a part of the country into hibernation. Put it to sleep. Keep the essential services running so citizens have access to food, medication, electricity is running, water is running, energy is running, financial services are running. We keep that part of the patient alive, but we want to put another part of the patient to sleep. And that is the main message that we would like to drive from yesterday and today going forward. Because if we don't drive that message, everything else about testing and facilities, it will be overwhelmed. And you will not have flattened the curve. So the main message today is stay home, stay safe.
Save lives.
Save lives.
Okay, I recognize Vern, 91.9 Tobago.
Hi, good morning. Vern Extavo here from 91.9.
Hi, Vern.
Morning.
Morning. This first question is for Minister Young, or even if Minister Dial Singh could chime in on it. I'm concerned about what is the threshold before we intensify the stay-at-home order. I know Anna Ramdas asked if we are looking at it, but in Barbados, the Prime Minister there did say they were looking at 25 before they went to stay home. Do we have a threshold that we're looking at if we reach a certain number of cases before we extend?
So as I just said a short while ago, we continue to get the advice of our medical experts. We were far ahead of most other countries in the decisions we've taken. So unfortunately, some countries may have taken decisions that we took earlier clock a bit later. There is no magic number. The CMO said that very earlier clock. The Minister of Health said that very earlier clock. There's no magic number that you're looking at. What you're looking to do is see how your stay-at-home advisory is being adhered to by the population. And as you mentioned that, I'm being asked here on my telephone, what is the difference between what the government has said, what the Commissioner of Police have said, for example, with the exercising? People, please, there is no divergence of views. The government has said, guided by our health experts, that we don't advise people, we strongly discourage people from exercising in public spaces. We've explained the medical reasons why. The Minister of Health has said so, the CMO has endorsed it, I have said so, the Prime Minister had said so. What the Commissioner was doing is he was referring to a power of arrest. At the end of the day, no one wants to get a power of arrest. Today, we're reducing the number of persons who may be out in public places, outside of the essential services, from 10 to 5. Understand all of these measures are for one simple reason. Stay home, stay safe, save lives. Because you're not only endangering yourself, But when you go out there, you're now endangering those that you come home to and those that you're in contact with as well. As Dr. Parasaram said, and I'd like to end my part on this note, we must start operating as though every single person has COVID and let that go through our psyche and let us take our personal social responsibility decisions on that basis.
Right, Vern, let me just, as you said, chime in here on the numbers. Suppose we had set a number, let's say 30 or 40, and I say when we reach that threshold, we do something drastic. So I want to show you why that may not be the best approach. Up until March 19th, we had 9 cases. Then, by March 21st, we had 49 cases. We went in 24 hours from 9 cases to 49. Now, if we had set a threshold of, let's say, 30 or 40, we'd have triggered that. But those 40 came from one incident. So therefore, it did not factor into a number to trigger more action. And that's why I keep referring. If we take out those 40 from our numbers, the numbers right now are not unreasonable. But if we don't stay home this week and next week, because this is when, unfortunately, I keep saying, the symptoms for those 19,000 people who returned last weekend, they are going to start to show symptoms on Friday, Saturday, Sunday, Monday, Tuesday. This is the period where those returnees, those citizens of Trinidad and Tobago who came in, if they don't stay home and infect their communities, this is when we could have some trouble. So again, the messaging is stay home, stay safe, save some lives.
Crystal Wilson, TTT.
Hi, good morning. Today, we understand is the deadline by the central bank for the exchange of the old $100 notes to the new polymer bill. We also understand that there are persons who came into the country and are currently in quarantine, and their sole purpose was to conduct that transaction. And they are asking whether or not, after today, whether or not they will be accommodated once they are given the okay and a clean bill of health to proceed.
All right. I have been in contact with the Minister of Finance on this point. I'd just like to remind Trinidad and Tobago, the demonetization exercise was announced in December. It was carried out and is now a world-class, a global first-in-class test case of how efficiently it was carried out in the month of December. The legislation allowed for a 3-month period. So every single person who had a $100 bill in their hand knew that the deadline date was going to be the 31st of March. Okay, nobody could have predicted COVID, but it has remained open. Persons could have asked persons to go along. At this stage, no decision has been taken with respect to these $100 bills, but we've had the last 3 months additionally to conduct the exercise of exchanging the old cotton notes for the new polymer notes. So at the end of the day, a sufficient period has been exhausted. It was said since December of last year, but the government will give some consideration and we will have that conversation.
Priya Bihari, ACP News.
Good morning. Good morning.
Good morning.
Minister Young, there are reports that the Vice President of Venezuela came in during the travel ban, and of course you would have given permission for her to come in. My question is, do you feel that that was prudent given the fact that we have nationals in Barbados, Venezuela, Margarita, and Suriname who also want, some concessions to come in?
The answer is yes. Request was made. The Vice President of Venezuela wanted to come in and discuss COVID-19 and how the approach to COVID-19 was being dealt with. I can tell you all, people make applications. So, for example, 2 CARICOM prime ministers have reached out to us making requests for Trinidadian technicians to come to their various jurisdictions to help them with getting their medical plans where they need it to be. We grant exemptions for that. Each application is being dealt with on a case-by-case basis. Understand that was always the intent of the law, but it is not exactly as what Minister Dial Singh touched on a short while ago. This is not 40-something, 50-something, 70-something people coming back in and staying here. There are risks right now with international travel. So even, for example, when some of these other states, so for example, the United States asked for a flight, permission was being granted. These are people leaving Trinidad and Tobago. What the warning to them is, understand right now one of the most risky places to be on is an airplane. That has been proven. People just look around at what we call the importation and the spread of COVID-19. One of the riskiest places to find yourself on right now is an aircraft traveling those long distances. So it is not something that is encouraged. Yes, the permission was granted, and it was a very, very short turnaround. The Venezuelans took serious medical public health precautions, masked up, gloved up, and this type of thing. And after the meeting was conducted, they left immediately.
Bina Mahes, ITV.
Can't hear you, Bina. Unmute your mic, please, Bina.
Bina Mahes. Okay, we'll come back to you. Akash Samaru, CNC3.
Bina is there now.
Oh, Bina is there.
I'm here.
Okay.
Okay.
Oh, thank you. Good morning, everyone.
Good morning.
National Security Minister, Mr. Young, this is for you. We have received reports of taxi fares increasing. A number of persons are saying that, for example, in South Trinidad, fares are increasing due to the 50% reduction that you stipulated that the passenger load should only be 50%. Now, is this legal in terms of other people having to compensate
all right,
taxi-wise, is it?
This is something that we projected would likely to have taken place. What is legal? The regulation stipulates that any person who provides public transport in a motor vehicle shall not carry in the motor vehicle more than half the number of passengers which the motor vehicle is licensed to carry. So we've reduced that. Remember, these reductions are being called upon and are now legal because we're trying to ensure that we reduce the potential spread of this virus. The same thing that we saw happening in other places, for example, some supermarkets, some products like hand sanitizers, the price goes up. Taxi drivers have taken this decision. At the end of the day, it's up to the traveling public. We're really trying to get you. Please stay at home, stay safe, save lives. We don't want people up and down all over the place. If you have to travel, unfortunately, this is one of the consequences. And I'll tell you this, it is not only here in Trinidad that this type of measure has had that type of effect. That has also happened in other jurisdictions around the world. We're really asking people to be socially responsible. Everybody take your own personal decision. But we're really encouraging people, unless it is absolutely necessary and essential, please stay at home.
Okay, great. I have one more question for the Health Minister. That's
Sure.
no problem.
Sure.
Okay, great. Minister, they are saying persons have called our newsroom expressing concern that they had to go for MRI examinations a couple of weeks ago and they were promised their results. They're wondering what is the status of the results, MRI results that is.
Okay,
would it be
so
transferred to another facility or would it be on hold?
I can't give you an answer now. If you send the information to me, Bina, I will certainly look after it for you. That is not a problem.
Akash Samaru.
Yes, hello?
Yes.
Right, I need to follow up on that first question. I'm going to kindly ask the moderator to not mute my mic like last time when I was continuing along this line of questioning. So if that would be appreciated. You all said that the person, as far as you recall from my statement, did not present any flu-like symptoms, but it was literally the first thing I said. So let me make it clear again for what I thought was clear. The person, flu-like symptoms, came back from the UK, was in close contact with a COVID-positive person from Singapore. And I'm asking you, is that not enough to be tested?
Akash, I wouldn't have personal details on every single
But it's
person.
not personal. Nobody knows who I'm talking about.
No,
But
you're
this is an
asking me
example,
as minister. I am saying if I get the person's name offline, I will certainly assist that person, but I can't respond to every single claim made in the public domain. I simply don't have the information on every single person, but we are committed to follow the protocols for testing that CARFA follows from PAHO.
Okay, folks, this brings us to the end of today's media conference. And do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to flatten the curve and beat COVID-19. May God bless Trinidad and Tobago.
And that was live coverage of media conference to update us from the Ministry of Health on COVID-19 here in Trinidad and Tobago. And just a quick review of some of the key points we just heard. Decision has been taken to further reduce public gatherings from 10 persons to 5 persons, and Minister Stuart Young says that is based on medical advice. Regulations will be amended today to reflect this change. Now, hospitals have made some changes regarding pregnant women. There will be new clinic times, limited visiting hours, and limited visitors. And this is to ensure the health and safety of pregnant women and their unborn babies. Now, the TNT Spirit has been taken off the Sea Bridge. The Galleon's Passage and the Jean de la Valette will make one trip per day, and the cargo vessel, the Cabo Star, will operate as normal. The Trinidad and Tobago Police Service is in search of a patient who escaped quarantine. The escaped patient has tested negative but was in quarantine, and the TTPS is asking anyone with information to contact them. You can call 999 or 555. And of course, we are being reminded that we must stay at home to stay safe and save lives. I'm Stacey on Providence. We are bringing you live coverage on TTT Talk City 91.1 FM, Next 99.1 FM, Suite 100.1 FM, and on Facebook at TTT Live Online.
This is TTT. Live for local.
The following message is brought to you by the National Gas Company of Trinidad and Tobago Limited, at the forefront of energy. Practice social distancing and protect yourself against COVID-19 virus. Keep your distance from other people. Respiration droplets from a cough or sneeze can travel up to 6 feet and be inhaled into the lungs of the person within range. Protect yourself by staying out of reach. Make a conscious effort to avoid crowds. For example, if within range, think about walking or riding a bike to a destination instead of taking public transport. Keep your distance and avoid contaminated surfaces, because more people means the more surfaces get touched. For example, door handles, phones, remote controls, light switches, and bathroom fixtures. Don't hug or shake hands. If you have to meet with someone in person, find an alternative greeting, tip your hat, wave, or offer a friendly gesture. It's up to you to protect yourself and your loved ones from the COVID-19 virus. The preceding message was brought to you by the National Gas Company of Trinidad and Tobago Limited, at the forefront of energy.
I kept saying 20 seconds. 20 seconds after putting soap on your hands. Okay, I'm going to teach you again. We go top, do this, and then just swap hands. Left, the opposite direction. I think you're about 17 seconds, 3 more seconds to go. There we go, 20 seconds done.
Even though primary school is closed, your child's education does not stop. Let them learn to read, spell, write, and develop basic math skills while having fun in the comfort and safety of your home using the JJ and Friends apps, workbooks, reading books, wall charts, and erasable writing mats, all designed using the Ministry of Education's primary school curriculum. Our 32 bonus apps cover subject areas such as physical education, Spanish, science, visual, and performing arts. Create the perfect learning environment in the safety of your home today. Let them have fun while they learn. Plus, get a free Amazon Kindle Fire. Develop your child's primary school education with the JJ and Friends JTAB suite. Call now 800-READ.
Knowledge is power. For students at home following the closure of school to contain the spread of the novel coronavirus, now you can view TTT and stream live on Facebook at TTT Live Online SEA Time, focusing on mathematics and language. All you have to do is tune in Monday to Fridays for mathematics at 9:15 a.m. and language at 1:15 p.m. SEA Time, Mondays to Fridays on TTT and streaming live on Facebook at TTT Live Online is an initiative of the Ministry of Education in conjunction with TTT Limited.
This is The Difference, a television, radio, and social media series in which we remove the clutter. I'm Samantha Best. Probably, Kaisonian Black Stalin says it all at this time. Trinidad and Tobago faces two serious crises. On one hand, the coronavirus, which the World Health Organization declared on Wednesday, March 11, a pandemic. On the other hand, the energy fallout between Saudi Arabia and Russia, which has caused a worldwide slump in energy prices. Both weigh heavily with uncertainty and have the potential to negatively affect our economy. In light of this global fall in energy prices, the Finance Minister, Colin Burt, said the government had no choice but to revise the price of oil in the 2020 budget downward. Most significantly, this will leave this country with a revenue shortfall of some $3.5 billion. But after a special cabinet meeting on Monday 16, the minister further revised that figure to a $4.5 billion loss, stating that it could eventually total some $5 billion. Yet the good news? At a media briefing on Tuesday, March 10, the finance minister reminded the country of this current government's track record in dealing positively with global financial crises. Minister Imbert spoke of 2016, when oil prices fell to $26 per barrel, which caused this country a loss of some $20 billion in annual revenue.